welcome, Jill. Thanks for joining us today on the podcast. I'm so excited to talk with you because you're a fairly new member of this team and you're doing just such amazing work. And I just want people to know all the great things that you're doing and your background and, just what they can look forward to in the future with your work. So do you want to just give us like a quick background, a summary of your background and where you're from and what you're doing now?
Sure. I went to grad school in Buffalo, New York, and I got my master's of science with an emphasis in art therapy. And I've been an art therapist for 30 years. I also work in academia. I'm an ethicist at Virginia Commonwealth University for a large institute that studies the behavior genetics of mental illness. I have been practicing as a clinician for, like I said, 30 years. I've worked with all populations, addictions, children, adults, but trauma is a passion for me. So I became trained in ITR about 2 years ago and been using it ever since then.
Awesome. How did you even hear about ITR?
Just researching on different ways to get trained in ITR, in therapy for trauma. And I came upon ITR and thought I'd give it, explore it. I did the 101 first and decided I wanted to do more.
So what's your results been? I know you've been working with a lot of different clients, and how do you see this has changed your practice?
I only treat trauma now exclusively. And I've seen with people that I treat that complete treatment, 100% positive outcomes. People are healing and getting better.
It's just miraculous. I know, it's fantastic. You shared a lot of your outcomes and results, and you just talk about a specific client maybe and what you've seen, the differences and how long and that sort of
thing. So, trauma can be, in my opinion, a one event, or it can be complex trauma with many events. And the hours that somebody is treated is reflective of that. I've treated somebody for 10 hours with one event and changed their life. It was a disaster where they lost almost everything due to a fire. And completely, the PTSD of that event went away in 10 hours. I've treated somebody up to 60 hours that had a lot of complex trauma and is doing much better as well. So I do outcomes. I'm very outcome focused. So I do pre-assessments with my clients at intake, and then I do post-assessments immediately after the work, and then ongoing in follow-up. And my work shows that everybody has long-standing relief from their symptoms after treatment.
Will you encourage therapists about using assessments? Because I know a lot of them don't use assessments for some reason. I don't understand that, but
well, it's hard. So you have to, put the extra effort into reaching out to your clients after they're done with treatment. And oftentimes they don't necessarily want to come back and do the assessments, but I think it's important. And I think the relationship that you have with the client, uniformly, I would say most 90% of my clients are appreciative of the follow-up and the reaching out and doing the assessments. They get a lot out of it as well, to actually see on paper their growth and to see that they're managing much better than they were before they came and had treatment. So it's really powerful in that way for them. It's also powerful for our future clients and for our clinic. Am I doing good work? Am I seeing a change in my patients? There's only one way to find out, right? In a quantitative way, and that is to do assessments. So I'm a true believer in that. And like I said, my clients love it. The ones that I have lost to follow-up have been on the younger side. And 18, 19-year-olds, they just don't want to think about it anymore, and they just kind of drop out. But most adults have no problem following up and, spending time with me and talking about what's going on in their life and completing those assessments. They're happy to do it.
Because I still think the younger ones see results. They just aren't because you'll do them pretty close to after treatment. So, right?
Yeah. Yeah, and I've even just recently started doing it. In fact, at the end, the last hour of treatment, just for kicks, because I want to try and compare. All right, you've done 15 hours. Here's your follow-up plan. Let's redo these assessments and see where you're at. And we're seeing changes there as well, like before they even leave after their intensive. So I've added that too to my assessments. And
That's fantastic.
Yeah.
Yeah, that's fantastic, because then they see right away the results, and they know that all the work they've done and the hard work they've done has been fruitful.
Yeah.
That is so
Yeah.
key. Because I do notice too that some clients don't recognize so much changes in themselves, but their loved ones may see changes. Have you had experience with that?
Yeah, for sure. Husbands saying, wow, that's, you seem so much more calmer. You're more responsive and less reactive. Because oftentimes people with trauma can be very reactive, right? A lot of the ITR psychoeducation and parts work teaches them to be more responsive in their lives and not just reacting. So yeah, that's what I think uniformly what a lot of people in the relationships see is that they become more responsive people, more thoughtful, able to think about what the response is and what they want to say and how they want to say it.
That's really encouraging to the family members and, their close relationships, because we know that all of us that have dealt with trauma, or people in our lives that are traumatized, it's rough. It's rough to be in an intimate relationship with them, and you understand it, based on what they've been through, but it's still rough and it can continue.
Yeah, that's true. Which is why people come to treatment for trauma, right? The reason everybody comes for trauma treatment is because things aren't working in their life, for whatever reason. And all of the symptoms related to PTSD, people just want to solve that. They want those symptoms to stop. They want the intrusive thoughts to stop. They want to be less reactive from the limbic system in an emotional way and be more responsive in a thoughtful way. So yeah, that's why they all come to treatment. Something's not working.
Good point. Very good point. How do you encourage someone to do ITR versus some of the other methods out there?
Well, I think that most people have experienced uniformly some level of talk therapy that hasn't worked for them at all for their trauma. People are interested by the art therapy element of it because that's something new and something different. And I'm also a board certified art therapist over and beyond my trauma training. So I think some people come and think, well, oh, maybe I could just do art therapy and not do an intensive. But, as we learn, as I work with them and they learn about how the trauma can be processed and moved in their brain and they understand what trauma does to their brain, I just think they get it that the ITR process makes a lot of sense for them. And while it's a huge commitment and insurance companies don't necessarily pay for it, if you add up a copay, if you're in therapy for a year and you're seeing a therapist once a week for a year, and you add up all of those $50 copays, that could pay for an intensive and you could be done in a weekend. And so sometimes I do describe it that way to my clients.
Oh, that's great. That makes a lot of sense to people. I know it's money up front, but I mean, what do they get from it? And then what time do they get back from that, of not having to go on and on and on and have crises of the week coming in?
That's right. And then relief from the symptoms a lot quicker than a year, right? And, the beauty of ITR is that we're teaching them skills so that there's a beginning and a middle and end to therapy as well. And they have skills when the intensive is over to work on that themselves. They don't need to stay in therapy for a year.
That's fantastic of letting people do their own work if they need to, or they can come back and do what Linda would call mop-ups, Dr. Gavin would call mop-up, where it's just quick things then, and recognize when a trauma happens to them. And so they know that probably at that point, it might only be 2 or 3 hours.
Right.
Medical trauma or something like that. What would you say to art therapists, or any therapist really, of why it would be a good thing to study ITR to add to their repertoire?
Well, I'll speak specifically for art therapists because art therapists are so used to using art on a, with every client. I think that the ITR structure of using the art, well, first of all, most people have experienced some sort of trauma. And so it's important to be trauma informed minimally. So I would encourage any art therapist to be able to be more trauma informed so that they can treat their clients. But the art therapists are uniquely trained to work with people with art supplies. And the ITR armature of the art part of that process is just comes naturally to an art therapist. And art therapists have the insights and the expertise to work with the art supplies and clients and use this structure in a really productive way. So I think it's really powerful. Using the art, the narrative therapy, and the parts work all together is great. So yeah, I think that art therapists are also very good at helping clients understand that it's not about making pretty pictures. It's about using art as a way to heal. And art therapists are uniquely qualified and skilled to help somebody realize that and help somebody do that and use the ITR method.
You're so right. This method is perfect for art therapists, and we're really, really focusing on art therapists a lot. I've heard art therapists say, this is the missing link. This is the thing that we need. And social workers and counselors can learn it too. So you don't have to be an art therapist, but for art therapists, it's a no-brainer to learn.
Yeah,
this
for sure. For sure. I agree.
And it moves them right into with the rest of the trauma teams. And it's brought a lot to the field, I think, of art therapy. Do you want to talk a little bit about using the feet as an assessment, Dr. Gant's formal elements art therapy?
Yeah, I use the person picking an apple from a tree pre and post treatment. So I use that as part of my assessments. So when somebody comes in, well, it's not in my intake. I do it on their first day in their first hour of their intensive. I have them draw a person picking an apple from a tree. And then I put it away. I look at it from a feet's perspective and see what's going on in the image. And it's very helpful and informative to me of what maybe needs person's presenting with. But then at the end of treatment, in the last hour during follow-up discussion, follow-up planning, when I'm giving them the post assessments, I'm also giving them the cue to do another person picking an apple from a tree. And then I put both of those images out on the table in front of my clients and say, what do you see? And uniformly, they all see a huge difference between the day, hour 1, and let's just say it was a 20-hour intensive at hour 20. They see a huge growth and they can literally see it themselves. They're usually a lot more richer. They have apples in a basket. They can problem solve. It's amazing, the stark difference between the two. And it's not because they've been drawing for 20 hours. It's because they're seeing the world differently. Their brain is working differently. And that's just how I see it. And it's really powerful for clients.
What would you say to therapists that are considering doing ITR of using the intensive versus hourly or some combination of it?
I prefer intensives. I prefer intensives in person. So that's like if you have a hierarchy of the way you want to treat somebody. Mine is intensive in person, then intensive virtual, or I would say intensive hybrid. Have somebody come for a little bit and then work remotely. Then under that would be intensives remotely, and then after that would be hourly. I think it's all possible. You can work all ways with ITR. It just takes a lot longer if it's not intensive. I think the in-person element I like so much because we're there together in a room where the artwork is in front of me. I'm watching them make the artwork. It seems to be just more powerful for me. But like I said, I've done it both ways. I did an analysis where I had 66% were remote and 44% were in person, and they were both intensives. And I saw no difference in the outcomes. So it worked both ways. I just feel like it's a little bit more efficient in person than it takes a little bit longer remotely.
Yeah, that makes sense. It's still
hard to work for 6 hours online on a computer. If I have somebody here in Richmond with me, they could come 3 hours in the morning, take an hour and a half break, and then work maybe 3 or 4 hours in the afternoon. And that's doable. It's not doable on a computer. It's too much. You just get saturated too quickly. So it's maybe 5 hours max a day online.
With that break in the middle still.
Yeah. Or a short break in the middle. Yeah. I just think it's harder to do a long day remotely.
That makes a lot of sense.
Yeah.
I know you've been using the web app. It is a beta version of the Health for Trauma app. How has that been? Do you feel like it's more helpful?
Most of my clients prefer not to draw in the app, but that's because I'm an art therapist and I have art supplies galore, especially if they're in person. And it works well scanning the images into the computer and then just placing the images in the app. I've had no problem whatsoever with that. I've had really great success with somebody working remotely, drawing in the app with a pen in the app on their iPad. They really like that. That provided a different level of imagery drawing with a pen in the app. But like I said, I'm kind of biased because I'm an art therapist, so I like to have, the real supplies. But yeah, I mean, I think the app works great for some people. And people who are really tech savvy like it. They like to be in the computer. Or I have some people who work at a computer all day long. They don't want to do it in the app, right? They want to use art markers. I just think it's a personal choice. But the app works well for the dialoguing, for organizing all of their work, for having it all in one place. That's a really nice part of the app for the person, that they have it all in one place.
Yeah, and being in person for sure, drawing. Although I'd have to say I've seen it too with some of the younger kids that the minute you bring in the technology and the whatever, if they're working on a tablet, they're like into it like that fast. That's what they want to do. And I guess some of them feel like drawing is like only little kids do that or something. I don't know, but it's really intriguing to see like the differences. But to have the option is really cool.
Yeah, it is. And the app works both ways is good too. That you can scan imagery in if somebody chooses to draw it. So yeah,
that's powerful. So you have been leading the research with ITR. What drives you to do that?
Well, I'm in academia right now as an ethicist for a large research institute. So of course, research is a priority for me. Publishing is important, and getting the word out there. And in order to do that, you need to have quantitative data that asks the questions: does it work? Why does it work? How does it work? And with evidence, we need it to be evidence-based. I mean, we all see people getting better, but we need to quantify it, and we need to get information out there that's peer-reviewed and published, that gets more interest in the field, so that we can have more people looking at ITR and doing studies with ITR, not just us, but other researchers who are, read an article on it and say, oh, that's interesting. I wonder how that would compare to this. And let's do a study looking at this and that. So yeah, I just think we need to, get more information out there. And so that's why I collect my outcome data. For 3 reasons. 1, to see if the person's actually getting better. 2, to see how my work is. Am I helping them? Is my work, does it have efficacy? And then 3, to be able to combine all that outcome data and see over a course of all of my clients, how do they compare? Are they all getting better? Only some getting better? And universally, everyone who completes treatment with me, whether it's 10 hours or 60 hours, ultimately gets better. I can say that with data from my outcomes.
Wow, that's great, Jill. That's really powerful. People's success rate. People ask all the time, what's the success rate? So would you be able to say 100% success rate based on that?
I do tell my clients that are coming in. I say, with people who do the work, finish treatment, they all 100% have better outcomes, proven better outcomes with symptom reduction, and in most cases, no more diagnosis of PTSD. no symptoms.
Wow.
So it's hard to, it's hard to tell somebody in a kind of like a qualitative way, right? Qualitatively, I could say like, yeah, I feel like all my patients got better. That's not quite as powerful as me saying, here, look, this is a graph of all my patients in the last year. And look, they're all better based upon these outcomes, right? Like I have a client who has a dog, and she could tell she's better because the dog doesn't need her as much. That's kind of a qualitative thing, right? Is it because of ITR? Who knows? But she's more relaxed, so therefore the dog's more relaxed, if that makes sense.
That's great. Yes, that makes sense. Well, I want to thank you so much for all you're doing and the work you're putting in to help get the word out that trauma can be healed and it doesn't take long to do it. And
Yeah.
just all the outcomes that you're bringing in and the presentations you're doing on that and getting into peer review journals. I just want to thank you from all of us at ITR for all the work that you're doing. We
Oh,
really
you're welcome. I'm so happy to do it. Like I said, I think that, the more we can get the word out there and the more we can get people thinking about ITR, being curious about ITR, not just patients, but, family members, academics, researchers. I think that the more people are be curious about it, the more work we can do and the more evidence we can get. And I just think that can't be a bad thing.
No, that's a good thing. Well, thank you, Jill. Thanks for your
You're
time.
welcome,
It's
Mary.
great
Yeah,
talking to you. Have a
no
great
problem.
day.
Bye.